So welcome everyone. We are so happy that you could join us today for the Building Agility and Fostering Post-Traumatic Growth in Rural Care Settings. I am very excited to be able to represent the Global Rural Nurse Exchange Network today and to be able to present to you our presenter. Dr. Tim Cunningham, who is a registered nurse with a doctorate in public health and a fellow in the American Academy of Nursing, is co-chief well-being officer at Emory Healthcare and the Woodruff Health Sciences Center at Emory University. He holds a joint appointment as adjunct associate professor at the Neil Hodgson Woodruff School of Nursing at Emory Healthcare, and he also serves as the vice president of practice and innovation for Emory Healthcare. He collaborates with interprofessional teams to support structural and systemic well-being changes for healthcare staff and professionals, university staff and faculty, researchers, learners, and community members. His clinical background in emergency nursing, however, he never thought that he would become a nurse. So Cunningham's first passion was in the performing arts, theater, clown, dance, and acrobatics. He worked as an early actor for nearly a decade in various regional theaters in the US and internationally. It was because of those experiences he began work with Clowns Without Borders in 2003. A small nonprofit organization, Clowns Without Borders sends professional artists into war zones, refugee camps, and other zones of crisis with a simple mission of catalyzing laughter and playfulness. Tim has performed in more than 20 countries with the Clowns. He served for 5 years as the executive director of Clowns Without Borders, and now he sits on their board of directors. It was working in a pediatric ward in pre-earthquake Haiti that inspired Tim to study nursing. He graduated from the Clinical Nurse Leader program at the University of Virginia in 2009, and that's where I first met Tim. And then he worked as an emergency trauma nurse at the UVA Health System, Children's National Medical Center, and New York Presbyterian Cornell. Tim completed his doctorate of public health at the Mailman School of Public Health, Columbia University in 2016. His dissertation focused on psychosocial support of expatriate Ebola aid workers in West Africa, with an emphasis on narrative medicine. He then joined the faculty at UVA with a joint appointment in the School of Nursing and Department of Drama. Tim is now a fellow in the American Academy of Nursing. His publications focus on compassion and well-being. Tim's co-authored textbook, Self-Care for New and Student Nurses, challenges the way we as learners and leaders approach the critical practices of caring for ourselves that we may care for others. And I have to give you a little side note. I had the wonderful opportunity to work with Dr. Cunningham when he was a student and work with him in remote area medical clinics and then in Haiti post-earthquake. And I have this really wonderful memory that's ingrained in my memory cells of my brain, where middle of the week, working in a makeshift clinic, and you're all tired, we've had little sleep, everyone's doing a lot of work, and all of a sudden, you just hear this laughter, and this laughter is carrying, and you can tell that it's not just children laughing, but it's grown-ups laughing too. And so I go to the door and I look out, and in the yard of the church, here is Tim working his magic and bringing laughter and smiles to the whole team. And this is a lot of what Tim has done in his career, in his multifaceted roles. So I want to welcome you. Thank you for being here with us as part of our series with the GRNEN. You can look on our website for other information and upcoming events. But for the moment, I'm going to ask you to give our attention to Dr. Tim Cunningham.
Thank you so much, Audrey. And I have to say, it's such an honor to be introduced by you. And I want to thank you for being one of my first mentors in nursing school, in working with me and putting up with me. And also offering me so many opportunities, the work we did at remote area medicine, the opportunities to work with you in Haiti, when you stole my bubble wand and made a whole children's book around the bubble wand's adventures through Haiti. I forget his name. He was a little teddy bear bubble wand. We've had a lot of fun together, and I'm just grateful for your leadership, your mentorship, the knowledge that you've shared with me and so many other students that we've worked with. So it's truly, truly an honor. As I begin, I'll ask if I could get permission to share my screen, and I'll go ahead and pull up some slides. And as I do so, I want to also begin, in addition to the gratitude to you, Audrey, I want to begin with gratitude to everyone here on this call. I have learned over time, having gone from a clown, a hospital clown, to a performing artist, to an emergency department nurse, and finally a leader in a large healthcare system. We've got 30 to 40,000 staff that the team that I work with in our Office of Wellbeing is accountable for. I've learned that the most important thing that I can do as a leader is to begin my days with gratitude. And so when I do that, when I start work, it's an email to someone, it's a handwritten letter to someone, it's points to someone, it's some way to say, thank you, I see you, and I'm grateful for you. And so I want to begin with gratitude to everyone here in this group to say thank you for who you are. Thank you for all that you have done and continue to do as we continue to move through this pandemic. I hear some people say the word post-pandemic. And when I hear that, it makes my stomach tingle a little bit and feel uncomfortable, because it's not post, we're still in it. I like to say we're in the peri-pandemic stage. So as we move together through the peri-pandemic stage, thank you all. Thank you, thank you, thank you for your ongoing work and for what you will bring forward. I call this talk Building Agility and Fostering Post-Traumatic Growth in Rural Care Settings. Here's some of my contact information in case you want to learn more. And as we move through these slides this afternoon, I want to acknowledge that people are tuning in from all over the place. I'm not exactly sure what time zone you're in, but if you're in a really late time zone, thank you. If you're in a really early time zone, thank you. And thank you all for finishing your day, perhaps some of us together. I'm going to share some ideas. And what I can tell you is that the ideas that I share are either evidence-based or evidence-informed, but it's also acutely important to recognize that when we talk about agility and post-traumatic growth, that the way we get to that is as diverse as this extraordinary planet upon which we live. So I might share some ideas that sit well with you and others that you might say, I'm not sure. As I share those ideas, I'm going to keep the chat box open, and I'm going to do some interactive stuff in a little bit too. So I'll ask you to hop on, and if you feel comfortable unmuting and want to share some ideas, or if you want to type in the chat box, I'll keep it open. I'll do my best to read the chats as we go through, because in the space of well-being, especially in working in rural care settings, there's still so little that we know. And I'm going to be the one talking a lot during this next hour together, but the reality is you all are the most knowledgeable ones because you know your teams, you know your cultures. So I want to honor that and respect that as we move forward. So any thoughts you have along the way, I'll do my best to keep up, and let's have a good time together. As we move into this presentation, it's also important that we begin with a land recognition. So I'd like to recognize and acknowledge that I am giving this presentation from the ancestral home and the unceded land of the Muskogee and Cherokee East tribes, which is currently called Atlanta. In reflection of where we are today, I'd encourage you to think about where you are, where you stand, where you sit, the good and the bad and the challenging history of the lands that we share, in recognition that by knowing where we are and where we come from, we can move forward together, hopefully better, and hopefully, ultimately, more compassionately. First exercise, I told you we'd be engaging, so we're just gonna jump in and go ahead and engage. The image in front of you is of a famous painting called The Great Wave. And it's by a Japanese artist named Hokusai. It was painted around about 1832. And we're gonna do a narrative medicine exercise together. What I would ask you to do is pause and take a close look at this painting. And as you look, I'd ask you to think about how you relate to this painting here and now today in reflection and relationship to the pandemic that we're continuing to move through. So again, I'll ask you to think about pausing, taking a close look at this painting and reflect about how you feel here and now today in relationship to the ongoing pandemic. And if you feel comfortable, I'd ask you to type in the chat box. I'll read in the chats what I see, or you can type in the Q&A and we'll share that. If you don't feel comfortable, it's okay to reflect in silence as well. I'd love to hear your thoughts. I see the word ups and downs. Thank you. I see overwhelmed. That's very real. And as you reflect, look at the details. What are the details that make you feel that way? Is it a shape of the wave, something you see in the books? What comes to mind? I see the word chaos, story of my life. Yeah, fear. Yeah. Teamwork. Hunkering down. And I'd ask for what? What comes to mind in this space? It's like waiting for the next big wave or issue to come. Ongoing, looking forward, unstable. Yeah. I can tell you that we did this earlier today as well. And these words that you're sharing are very similar to words that people shared earlier. Waves of uncertainty. Yeah. And I'll ask one last thing as you look at this painting, to consider aspects of strength that you might see in this painting. And I think this person just read my mind. You say, holding on to get through. Are there aspects of strength that you see in the painting? And how does that resonate with you? Perhaps it's the wave, the mountain. I see the word courage. I see cannot see the big picture for what is right in front of you. Yeah. Yeah. I share this practice with you all. And if someone wants to look at this painting again, or if you want to use this exercise, everything I share today is up for grabs. Feel free to share it. Again, it's called The Great Wave. You can Google it by artist named Hokusai. I see this comment, together. That's beautiful. The reason I opened with this exercise, well, there are a couple of reasons. One is it's a different way to start a talk. And I think it's important, especially after, for me, a long day of work, I got to shift my thinking a little bit. And secondly, I started this as a narrative medicine practice. And some of you may be aware that literature and research around narrative medicine practices defined as close engagement with the arts. So coming together with a group of people, looking closely at a painting, talking about how you feel, maybe reading a piece of literature together, a poem or a short set of prose, listening to a song together, a piece of music, looking at a sculpture. Narrative medicine, closely engaging with the arts. Research with nursing and medical students say that when learners do this consistently, maybe once a week while they're going through their learning process, we have seen significantly higher scores in empathy and altruism compared with control groups. Further evidence on narrative medicine says that when people practice narrative medicine together, they actually come together as a team and they feel more connected as a team. And I think most interestingly, there was a randomized trial of interns. These are surgical interns in their first year, their internship year of their surgical residencies. And they were randomized to two groups. One was the control group, who just went around their regular surgical training, kept doing what they normally did. And the intervention group had to go to a art museum once a week and look closely at a painting just like this one and talk about their feelings, talk about what they saw, how they connected. Researchers who ran this study found that the group that had close engagement with the arts regularly, of surgeons, whether they liked the art or not, they showed significant increases in the ability to pay attention. So let's think about that from a surgical standpoint. The surgical teams that many of you may work on or may have worked on, or if you ever have to receive a surgery yourself, don't you want to know that your team is really good at paying attention? And if close engagement with the arts can not only help us improve our attention scores, we can also have fun and we can think a little bit differently. More than ever, I would argue that the arts are a great way to help reduce our stress and keep our minds agile as we face the daily problems, conflicts, concerns that we are facing, not only from this pandemic, but the daily concerns and problems around systematic racism that we see in this country, in the US and other countries, of bias, of genderism, of homophobia, as we see the ongoing struggles, as we think about and learn about our neighbors in Ukraine suffering war, the ongoing traumas around this world. Arts can help bring us together, and it doesn't take long to do. Secondly, in thinking about the arts, I'd like to also acknowledge this concept, perhaps you've heard of it, called love. And I'm citing the words here of the great and sadly late Bell Hooks, who passed away at the end of 2021. And the book that she wrote called All About Love, New Visions. All About Love is all about love. And throughout the book, Bell Hooks reminds us that love is as love does, and that love keeps us more alive. So in the space of agility and thinking about post-traumatic growth, which I'll speak about in a few more slides, I'd ask you to reflect on love. The love that perhaps brought you to this extraordinary profession in the first place. The best profession on the globe, I would say, as a nurse leader, as someone who inspires learners. Reflect for a minute on the love that brought you here. Was it love for a family member who maybe was ill and received extraordinary care? Was it love for a family member who maybe was ill and received horrible care? And you said, no one should ever receive care like this again. I'm going to become a nurse and make it different. Is it love for your community? Is it love for the preservation of your family, your community, the world around you? Is it love for science? Is it love for knowledge? Is it love for curiosity? I'd ask you to reflect on what that love is. And throughout the rest of this conversation, go back to that. Touch base with that. Feel some gratitude for it. And I'd encourage you again to maybe bring this back to the teams of people you work with as a reflection point. What is that love that we are all rooted in and that can help get us through some of the toughest situations that we continue to face? And in mentioning love, it's also important to mention grief. Grief, well, I can't see anyone's screens, but I'll ask, was anyone working as a nurse back in 1917, 1918 in the US by chance? Question mark. I don't think so. But I don't think this country, the United States, has seen collective grief when it comes to a pandemic since the influenza outbreak of 1917 and 1918. I'm excited to say that here at Emory Healthcare, and this was publicized in the media, so I can share this. At Emory Healthcare, we treated a woman, a very, very old woman, I forget her exact age, with COVID. Fortunately, she survived. It was a haul, but she survived COVID. And while we were treating her, she told us that as a child, she remembered getting the flu back in 1917-18 influenza outbreak. So she has survived 2 massive pandemics. And she went on to share her stories of loss. And we're reflecting now more and more that we have collectively experienced a sense of grief that few people in this country, at least, have ever experienced. So I want to acknowledge that. And I want to share some words from the great author Chimamanda Ngozi Adichie. She's a Nigerian author. This is from her book, Notes on Grief. She wrote this book in reflection of the death of her father, who died in April of 2020. And I'll read this out loud to you. And if you are comfortable, if you're not driving or flying a plane or driving a boat or swimming or anything like that and can safely close your eyes, I'd encourage you to close your eyes. I'll read these words for you. Grief is forcing new skins on me, scraping scales from my eyes. I regret my past certainties. Surely you should mourn, talk through it, face it, go through it. The smug certainties of a person yet acquainted with grief. I have mourned in the past, but only now have I touched grief's core. Only now do I learn, while feeling for its porous edges, that there is no way through. I am in the center of this churning, and I have become a maker of boxes, and inside their unbending walls, I cage my thoughts. We've acknowledged the land that we are on. We've acknowledged love, this powerful force that keeps us moving forward. And I'd ask us all to think about grief too. And the boxes that we've created as healthcare professionals, we've had to create because sometimes we just have to keep pushing through. Audrey, I think about our time in Haiti. We saw some pretty intense suffering, and I created boxes to protect myself and to feel like I could still function. We've all created boxes, and in this time, as we move through this peri-pandemic stage, I think it's on us to help us begin to unpack some of those boxes, to pause when grief arises, to share time with our teams, to listen, to move off our agendas, and let grief be what it is, because I think we've closed it down so much because we've had to in this pandemic. If we don't give it space to move forward, we're going to be in trouble psychologically and collectively. So as we move through this space today, I'd also ask you also to think about grief and how you relate to it. And if it rises in our time together, that's okay. We'll pause too, and we'll be with it. I have a question, and feel free to type it in if you think you know the answer. But what does every good story need? Can anybody tell me, what does every good story need? Or maybe not even a bad story might need it. It needs three things. Anybody know? Do 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 do. I know you're thinking it. I know you're about to type it. What does every story need? Protagonist. Yes. Bravery. There we go. I see it. Patty McNamara. We should give you an award at the end of the day. Every good story, yes, needs bravery and a protagonist, but it begins with clearly a good beginning, a middle, and an end. We're going to get back to this idea of stories in a second, but as we think about the context of stories, I'm going to ask you in your own story and your own work, what do you need to be well? As you think about your journey through healthcare, your beginning and middle and end, what do you need to be well? And feel free to type it in the box. If you want to stay quiet, we'll pause for a second too. Silence is not so bad. But feel free to share. What do you need to be well? Support, hope, words that I see. What do you need to be well? Sunshine, time for quiet reflection, outdoor time, time with friends, encouragement, balance, laughter, yeah, love in this story of your life, beauty, absolutely. And as you think about what you need to be well in your own well-being, I'd ask you to think about love and support. Awesome, thank you. I'd ask you also to think about what do your patients and families need to be well? And we can continue this thread. What do you need to be well? What do your patients and families need to be well? Listener, they need to be listened to. Yeah. Maybe having their stories be heard. Maybe being seen. As Audrey mentioned in the introduction, I've had the opportunity to share some laughter with folks, to work with folks around the world with an organization called Clowns Without Borders. And in that, I've had the opportunity to experience laughter, as someone mentioned earlier, compassion, as someone just mentioned, that yes, our patients and families absolutely deserve. And I'm still feeling a little bit of jet lag, to be quite honest, because just a couple of weeks ago, I had the opportunity to do some clown work in northwestern Iraq. I'm actually not allowed to disclose the exact location for security reasons for the families and people that we worked with, but we were working with people who had immigrated, who were refugees from Iran. They're Kurdish and don't have any state. They're not allowed to have passports. The refugee camps they're living in had very little support and external support because these Kurdish family members are not recognized by any state. We were invited to go and do clown shows and workshops. These are a couple of pictures from the shows. And I want to share a story. And I see your comments here, Audrey, what our patients and families need. They need to be heard and they need to be cared for. So in this story that I share, and we'll talk a little more about storytelling later, a young woman about my age had been living her entire life in this camp. Now, this camp was an old camp. It's more than 40 years old. And so they're stone walls and electricity and water. It's not tents like many of us think when we think about refugee camps. And this woman said when she came with her family early on to escape the torture, the traumas, and arguably genocide from the Iranian regime at the time, she said she and her family would often say, we will go back home someday. We will go back home to Iran someday, inshallah. Inshallah meaning God willing or hopefully. And she said, Tim, over time, as years passed, I've stopped saying the word inshallah. I don't say I'll go home inshallah, God willing, or hopefully, I now say, I will go home. I will go home. I will go back to my country and my homeland. And if I don't, the generation after me will. And if they don't, the generation after me won't or will. And she went on and she said, I've gone from hoping to knowing. And through laughter, we can move from hoping to knowing. In being heard and in sharing the stories of other people, we can transition from hopefulness to doing and moving forward. And in doing and moving forward in the face of a pandemic, in doing and moving forward in the face of suffering, or in the case of the Kurdish families that we worked with in the face of war and active discrimination from a government, we find the opportunity to experience post-traumatic growth through our own lived experience and stories. Post-traumatic growth is a concept by Calhoun and Tedeschi that I want to share with you and ask you to think about in your own journeys. What does that look like in your experience, post-traumatic growth? But before I share the aspects, the 5 sort of tenets of post-traumatic growth, I want to be clear. Post-traumatic growth is not a fix-all or a cure-all for post-traumatic stress. It's also not a way to cure or push aside post-traumatic stress disorder. I share this because I've had the opportunity to do some research. We're working on some publications right now about post-traumatic growth, and I've had the opportunity to speak about it. And oftentimes people push back and say, well, what if someone has experienced countless traumas and they've gone through all these stressors, and then you were to say, good for you, you have post-traumatic growth. Someone might hear that as a way to say that negates all their past suffering. No, that's not what post-traumatic growth is about. What post-traumatic growth is about is showing these 5 aspects: personal strength, closer relationships, a greater appreciation for life, new possibilities, spiritual, religious, or existential development, whatever word you choose. Post-traumatic growth helps us as individuals, teams, and leaders recognize the small and sometimes large steps that we're taking as we move through our trauma. Post-traumatic growth is also a little misleading. It does reflect on traumas that have ended. Perhaps you have survived a war and escaped a war zone. You've survived a horrible car accident. Those are traumas that might have ended. But post-traumatic growth can also be about peri-traumatic growth, the ongoing traumas of this pandemic, the ongoing traumas of systemic racism, the ongoing traumas of bias and genderism, classism that many of us have experienced and faced. Post-traumatic growth can still hold and help us recognize how we've become stronger through that. So it's a big concept, and I want to share some ideas on how we might be able to build post-traumatic growth and ultimately agility in day-to-day practices. So I'm going to share some things. I call them agility tools. These are all based in evidence-based or evidence-informed. And one of the guiding concepts of the next few slides I'm going to share are everything that I'm going to share with you can be and should be done at work. Because I'll ask you all to think about, does anyone know the definition of burnout? Burnout is defined by the American Psychological Association as a work-related syndrome. And then it goes on to talk about how burnout makes us feel more withdrawn, makes us feel less effective. Feelings of burnout can make us feel less passionate about the work or the people that we're serving. But it's important to point out that burnout is defined as a work-related syndrome. So everything that I'm going to share with you can be done and practiced at work to both build agility and help decrease burnout. If burnout occurs at work, we should do stuff at work to decrease burnout and not say, let me wait till I get home after work to decrease the burnout. That's not the way to do it. So we got to think differently about it. And finally, the things that I share, I'm going to ask you to approach by using the frozen model of change management. Perhaps you might not be familiar with the frozen model of change management, which is good because it doesn't actually exist. What I mean is, things I share with you, if they resonate with you, give them a try. Try them out yourselves, bring them back to your teams, try them with your family if you like. And if I share something with you in the next few slides that you don't like, frozen model of change management, let it go, you don't have to do it anymore. Seriously, if you don't like something I share, don't try it, because we know 2 very important things. First, we know that agility practices, resilient practices are as diverse as this extraordinary planet upon which we live. It's not a one-size-fits-all. It doesn't work for everybody, but many things work for some people. That's the first point. And the second point is, if there's a practice that you think your team might like, but it doesn't really sit well with you, don't make your team do it. We know more and more that authenticity is so important when it comes to agility and decreasing burnout and building post-traumatic growth. So if you authentically like it, try it with your team. But if you don't make your team do it either. They're going to see right through it. Okay, put your seatbelts on. We're going to burn through 3 slides real quick with a whole lot of information. Here we go. First and foremost, this practice called 3 good things or 3 wins. There's a lot of great research coming out of Duke University around this practice. It looks like this. At the end of a meeting, at the end of a huddle, at the end of a shift or time together, someone in the group says, let's talk about 3 good things. And you popcorn you say 3 good things that happened during that time together. This was good. This was good. This was good. You could call it 3 wins. This was a win. This was a win. You could call it pivots if that's a more appropriate word for your team. The important part is you only take a couple minutes to do it. You say the things that were good, and then you say thank you. You end that time together and you move on. What you don't want to do is overanalyze why it was good. We live in enough analysis paralysis. Just put it out there. And we know that by doing that, that can increase a sense of teamwork, decrease a sense of stress, and also help people who maybe didn't feel like they had an opportunity to share their voice in the time together to feel voiced. And we know it's so important to acknowledge the voices of everybody. And this is one way to help do that. Another practice, gratitude practices. I begin this conversation with that. Begin and end your workdays with gratitude. Writing notes to people, thanking people, calling people, reaching out, reflecting on gratitude. Again, can decrease sensations of stress and can help bring your team more closely together. Pause. I've had the opportunity to be mentored by a nurse who started the pause at the University of Virginia. And since we got a grant and we're able to do some research on it, the pause looks like this. I'm going to share 2 versions. One is after a person or a patient dies, the folks who are taking care of the person stops, and one person on the team says, it could be anyone, it could be a nurse, environmental services, a chaplain, a technician, a social worker, a physician, doesn't matter who. They say, let's pause for a minute. Let's pause to honor the life of the person that ended just in front of us. We can know that they were loved and that they loved, even if we didn't know them. We can know that they were a part of a family. Let's pause to honor them. And let's also pause to honor everybody on the team that did everything they could to care for this person. And then the team pauses in silence for 15, 30, 40, 60 seconds. And then at the end, the person who started the pause says, thank you, and you move on. You don't have to do this just when people die. You can do this at the end of a meeting, a good meeting or a bad meeting, doesn't matter. You can say things like, let's pause before we move on to the next thing in silence to honor everybody that brought their knowledge and wisdom and experience to the table today, whatever that was. Let's pause to recognize that and reflect on how we can use that to improve the lives of the people we serve. Again, you pause in silence for a few seconds, you say thank you, and you move on. Our research on the pause has said it spread to more than 134 health systems across the world. We've learned that when people practice the pause, they feel more connected with the team, their teammates. They feel more present with the next patient or families they move on to see. They feel more connected. People that we've interviewed about the pause who have a religious or spiritual practice say that when they practice the pause, they feel psychologically safe to pray quietly the way they believe is important to pray over the body of the person. And then we did a recent randomized trial in which we learned that when people practice the pause, physiologically, they're more apt to be able to connect with more people. It's called prosociality, and it's measured by heart rate variability. We found a significant increase in heart rate variability. So the pause that only takes a few seconds has some great physiological and emotional outcomes. Stretching, move your body. I like to say, move it while you got it. I can't see anyone on the camera right now, so no one's watching you. Move your shoulders, move your head like a chicken, shift around in your chair, move, stand up, walk around, move it while you got it, and encourage your teams to stretch and move. Another great practice called cognitive forcing. We've learned a lot from our nurses during this pandemic that when they're treating someone, for example, someone who made a decision that the nurse might disagree with. They might be treating someone dying of COVID who chose not to get vaccinated. And now they're in the ICU consuming massive resources. Many nurses across the country and the globe have reported how it's hard to be compassionate for someone who made a decision like that, knowing they wouldn't end up in this position otherwise. And nurses I've spoken with directly say, I just can't do it anymore. I've lost that sense of compassion. A way to help manage that, this is not a cure-all, but it can help, is called cognitive forcing. And an example of that is when a nurse walks into a patient's room, a patient they might disagree with, they can say to themselves quietly in their minds over and over again, sort of a mantra, they can say, this person too was once a child and needed to be loved. This person too was once a child and needed to be held. This person too was once a child and deserved the best care. By repeating that, I've heard directly from nurses anecdotally that helps them stay a little more connected and grounded and able to provide care for the patient, even though they're upset, frustrated, and exhausted. 4-7-8 breathing. It's a practice that I think I learned at University of Virginia, actually, way back in the day when I was a student. You breathe in for the count of 4, you hold for the count of 7, you exhale for the count of 8. And you do that for just a few cycles. That can slightly increase vagal tone and help you feel a little less stressed and help you feel like you can concentrate a little better, paying better attention. There that is again. You can also do box breathing called 4-4-4 breathing. You breathe in for the count of 4, hold for the count of 4, exhale for the count of 4, whatever you choose. And I've found that when I do this during stressful meetings, it helps me prevent from saying the words that I might say that might just come out that I know is going to cause harm, it's not going to be beneficial for the meeting. I can breathe it out and then say words that are beneficial, even if I'm frustrated or in big disagreement with the people I'm working with. Communication boundaries. Things like, if you call me during working hours, I know it's an emergency, so I'm going to pick up my phone. If you text me, that means I've got, a couple hours to respond to you. If you email me, know that I'm not going to respond for up to 48 hours. That's just the way it is. Establish those with your team. Be clear and consistent with those, and those can reduce stress and help you think more agilely about the work you do. I see the comment here, box breathing has been a game changer for me. Thank you for sharing that. I'd encourage you to give it a try. Narrative medicine, we did that at the beginning of the presentation, close engagement with the arts. Music, if there's an opportunity to play music where you work, it can reduce stress. Share music with your colleagues. Creating a reflective and restful workspace. You can do this at work and at home. Is there a space at work where you can go debrief, let it out, be away from patients and staff for just a minute, be yourself to put yourself back together and go back in? Do you have a space in your home where you maybe have no screens, no phones? I've got 4 screens right in front of me. Can you have a screen-free space where you can just be for a minute? All can help build agility and help these practices help us open our minds so we can think a little bit differently. Few more ideas, therapy, engaging with a therapist, or peer support. We have a great program at Emory Healthcare that my dear colleague, Dr. Trina Geyer, stood up, and I'm honored to have the privilege to be able to work with her on it and learn from her about it. We have a peer support system in recognition that there's literature that says after secondary trauma or stressful experiences, roughly 75% of healthcare workers, this study was done in the US, so American healthcare workers, 75% of them just need someone to talk with afterwards. And that's enough to help them kind of calm down, get their minds back together. You don't have to talk right after the experience. At some point, it might be months later or years later, but another peer, another nurse to speak with. And then that gives space for the other 25% of folks who might need a higher level of care, a therapist, a psychiatrist, a psychologist. Peer support's great. After the conversation earlier today, someone emailed me and said, I'd love to set up a peer support system. I connected them with my colleague, Dr. Trina Geyer. So if you have questions about peer support, I'm happy to follow up with you. And powerful, important stuff. Silo busting. When you have a meeting, ask during the meeting who's not at the table. If someone says so-and-so or a certain role is not there, then say, why are they not here? After you get that answer, then say, what will it take to get them at the next meeting? By bringing new people, new voices to the table, we build diversity, we build inclusion, we build equity. And in doing that, we open ourselves up to be open to new ideas, because the same old thinking is not going to get us anywhere to where we need to go as we continue to move through this pandemic. Calendar blocking. When you're not at work, don't be at work. Okay, easy to say and hard to do. I struggle with it myself, but do your best to take time away from work, because then your brain can refresh and you can come back to work that you're passionate about with fresh ideas and new ideas. Do your best. Like I said earlier, pause for grief when it arises. It's real. Hold that space for yourself and for others. We'll get through it. I promise you. And finally, engaging with nature. Get outside. I loved working as an emergency nurse because you could walk right outside the emergency department and be out there. I don't know if y'all remember back in the day where it seemed like every nurse smoked. Now, what I'm about to say is not an endorsement of smoking. We know that that is bad for you, but the benefit in taking smoke breaks is that it gets you outside. And I reflect on my mentors and people that I learned from who would smoke cigarettes. They were outside as much as they could be. What if we took non-smoking smoke breaks, but intentionally took a minute to walk outside? There are countless benefits to nature, so get outside. I just shared a whole lot of tools, and I want to acknowledge that you have your own tools that you know about. Unfortunately, we don't have time in this conversation to open up the chat to hear all of your tools, but I'd ask you to think about what are the tools you've used to preserve yourself? Tools for self-care, tools that build that mental and physical agility so you can be compassionate even in the hardest of times. And I'd encourage you to mentor others with those tools you've used. Some of your colleagues might like those tools. Others might choose to approach with the frozen model of change management and let them go, and that's okay too. What are your tools? And one of your biggest tools that you all have goes back to that question I asked earlier, the elements of a story. What is your story? My friend Danielle Spencer published this book, Metagnosis. I think it's a great book because it has an origami unicorn on the cover. It's also a great book because she reminds us as nurses, we are an integral part of every story of every patient that we work with, every team member that we work with. And sometimes when our team members are at their lowest and extremely vulnerable, or patients are extremely weak and sick, sometimes we become the narrators of other people's stories. And what a sacred and profound honor that we share and carry as nurses and build to our own stories. So as you think about your own agility, think about your own story, think about the clear elements of a story that were mentioned earlier, clear beginning, middle, and end, and how important it is to have those aspects of the story so we can make sense of them. Even if the aspects of the story come in different order, we might get the middle first and then the end and the beginning. I love watching Netflix and I love long shows that begin in weird places and you try to piece them together. The abstraction of story that makes our mind excited, that inspires us, and that inspiration of understanding our story and the stories of others can help us remain mentally agile and thinking about new ways to lead through this pandemic. The sad challenge that the pandemic has brought forward is that many of our colleagues have only gotten one part of our patient stories, and that's the end. So I'd encourage you all to think about constantly story crafting, reflecting on stories and what they mean. And in reflecting in that and building our agility, those practices can help us think with what people call a beginner's mind. Shunryu Suzuki, this is kind of a famous quote in some areas, where Suzuki once wrote the words, "If your mind is empty, it is always ready for anything. It is open to everything. In the beginner's mind, there are many possibilities. In the expert's mind, there are few." Now, we are all experts. We wouldn't be at this table if not. But how can we live and practice with the beginner's mind to put our expertise on the side for a minute and say, can I look at this as if I've never seen it before? Can I approach this as a beginner? And in doing that, some new ideas might pop up. My friend and colleague, Dr. Mick Krasner, who contributed to the textbook that I was fortunate to co-author, writes about beginner's mind. And he goes a little further and he says, when we as healthcare professionals practice with the beginner's mind, we are also able to practice more compassionately because we're more open and available to what's in front of us. Now, that's really hard to do when we're exhausted. That's really hard to do when we're stressed. And so it takes practice, time after time, to practice being present, to practice those agility skills, which can help us be more present and help us maybe think differently as we continue to do this work. It's not impossible, even though it feels like I'm sharing a lot. We can continue to build our own agility, and one way we can do it is beginning by looking up. The picture on the left of the screen is of a young child. We got permission from the child and the child's mother to take and share this photo. This is a young child that we met while I had the opportunity to work in a Rohingya refugee camp in southern Bangladesh a few years ago. This child and her mother had experienced profound trauma in escaping the genocide that was occurring in Myanmar at the time against Rohingyas. And when we worked in this clinic, we found and we listened to a lot of stories of profound suffering. And at the same time, when we would leave the clinic, we would see kids flying kites, looking up. And when we would see that, we felt happy. We felt connected. I don't know why, till I read this research by a guy named James Austin in his book, Zen in the Brain. And he talks about this research about how when we actively turn our eyes upward, if we're able, that engages a different attention system in our brains called the ventral attention system. I'm not going to go into too much depth here, but basically, when we're thinking and spending time in our ventral attention system, we're more likely to think thoughts about other people. Austin calls it allocentric thinking. Allo is Greek for other. By actively looking upwards, we can engage our minds to think more about other people. I think that's really exciting. So as exhausted as you might be, maybe it begins by looking up. Now, here's the scary part. The science also suggests that by actively looking downwards, we engage our brains to think more in the dorsal attention system, and that attention system is associated with egocentric thinking. So if that science holds, think about the direction you often spend your days looking. I don't know about you, but I'm often looking down at my phone, texting, trying to keep up, doing emails on my phone, looking down at my computer. And if the science holds, does that make us more selfish? I hope not. But we have an option to think creatively, to think inclusively, to practice our own agility, to build post-traumatic growth. Perhaps that can begin by looking up. And in looking up, I reflect on my own experience moving through my own secondary traumas, having had the opportunity to work as a frontline nurse during the West Africa Ebola outbreak. I spent 9 weeks working with an organization called Partners in Health as a pediatric Ebola nurse. The survival rate of the kiddos that we worked with was only 20% for children under 5. It was the hardest work I've ever done. And when we would walk to and from the Ebola treatment unit with our teams, we would see healthy kids outside playing, flying kites, looking up. And when I came home from doing the work in Ebola, I was living in New York City at the time, I couldn't sleep. I felt a lot of post-traumatic stress disorder symptoms. And so I sat down and I wrote, and I ended up writing a children's book, telling the story of a child, the first child that I treated that died under my care of Ebola. I didn't know much about this kid's story because when I walked into the unit that day, the child was actively dying and obtunded. So I didn't know anything about this child, but I needed to make sense of it. So I wrote a story about kite flying and what I imagined this child's life to have been like before they got sick with Ebola, which is to say, when we think about connecting with stories, even if we don't have all the parts of the stories, the beginning, the middle, and the end, we can get creative and add those parts. And in doing that, and in doing this children's book with my colleague Diala Brisley, who's the brilliant Syrian illustrator, that's why this book is in Arabic and English, we found peace. So how do you remain agile with the stories of what you know and what you don't know? How do you maintain your agility practices? How do you as leaders help folks recognize when they are experiencing personal strength as related to post-traumatic growth, when they are experiencing closer relationships, a greater appreciation for life, new possibilities, and spiritual development? Again, post-traumatic growth is not a cure-all at all, but it might be a way to help us keep moving forward. And another idea I'd like to share with you comes from the words of the great Viktor Frankl, who many of you may know wrote much of his book, Man's Search for Meaning, while living and surviving in a concentration camp. One clear and important last aspect around agility I want to share with you in this quote. So again, if you're comfortable and safe closing your eyes, I'll read it out loud to you. Frankl writes, "The attempt to develop a sense of humor and to see things in a humorous light is some kind of a trick learned while mastering the art of living. Yet it is possible to practice the art of living even in a concentration camp, although suffering is omnipresent. To draw an analogy, a man's suffering is similar to the behavior of a gas. If a certain quantity of gas is pumped into an empty chamber, it will fill the chamber completely and evenly, no matter how big the chamber. Thus, suffering completely fills the human soul and conscious mind, no matter whether the suffering is great or little. Therefore, the size of human suffering is absolutely relative. It also follows that a very trifling thing can cause the greatest of joys." I'll ask you to remember the joys the moments of joys, the trifling joys that you've experienced in your work, that you experience with your team, that you experience as nurses and healers, and how that joy too can expand and fill the entire planet like a gas, like oxygen, if you let it. And as we laugh together, there too, we experience agility. Someone mentioned that earlier. Laughter is a key to well-being. So we laugh, we play, and we can think a little bit differently. We often work and live in a scarcity mindset, a mindset that begins with no, we can't. It's not been done that way. We don't have enough stuff. And the reality is often we don't have enough stuff. I think a reality from this country that I live in that's a stark reality is that we spend so much money on healthcare, and yet we still don't have the ability to get healthcare to people that need it. And that's why I'm so honored to spend time with you all, because you all are doing the work. And I would think that many of you in being successful have flipped this paradigm. Instead of putting scarcity over abundance, you put abundance over scarcity. Author Edgar Villanueva, in his book, Decolonizing Wealth, talks about the power of thinking abundantly, facing problems with the first thought and question of, so who's here at the table? What wisdom do we have? What knowledge do we have? How do we know we can fix it? What can we do to fix it with who we have? Building off of abundance over scarcity. Researcher and physician Anna Lemke goes on to talk about this idea of abundance model over scarcity in her book, Dopamine Nation. And she shares some research that's come out of the University of Rochester and Stanford that has found that when people live and work in an abundance working model, meaning we will build off of what we have, we'll get creative, they're also more likely, leaders are more likely in abundance models to tell the truth. And people working in abundance models are more likely to believe the truth. Scarily, Anna Lemke's research has found that when people work in a scarcity model, there's a lot more lying that occurs from leaders amongst team members. When we think abundantly, we're more primed to tell the truth, to experience the truth, and I would say ultimately to be able to be more compassionate with the care that we give. This is a lot to think about. We're not going to fix this in one day. Nurses have been at the front lines of every pandemic since the beginning of time. And we've continued to learn, and we've continued to grow in our own post-traumatic growth. And as I think about that, I think about these words of Audre Lorde that I would like to close with. Audre Lorde is a famous activist, poet, professor, writer. And she wrote these words in the last book that she published before she died. And this is reflections of her own experience as her life ended after a long struggle with liver cancer. She wrote these words, "Tomorrow belongs to those of us who conceive of it as belonging to everyone, who lend the best of ourselves to it, and with joy." Tomorrow belongs to those of us who conceive of it as belonging to everyone, who lend the best of ourselves to it, and with joy. And it's with joy that I will close and say thank you. Thank you to who you are. Thank you for what you do. Thank you for the ongoing work, leadership, and mentorship that you all do collectively to improve health on this planet. Even though sometimes we feel like the flower carrier you see in this Rivera painting, burdened, yet burdened by some of the most beautiful things, which is health, which is love, which is compassion. So thank you all, and I'd encourage you to keep seeking those small joys and let them fill this planet like a gas. So thank you all so very much. Audrey, I'll turn it back over to you. We might have some time for questions, and I'm happy to answer any questions that I can. But thank you again.
Thank you, Tim. You've shared with us a lot of information, given us a lot of food for thought, given us some future reading and some future self-worth and teamwork to work on. So are there questions from members of our team today who've come, who've listened, whose cup has hopefully been filled back up? Seeing lots of thanks for Tim in the chat box.
All the way from Wyoming and New Zealand and Australia too. How cool.
South Dakota.
I love it.
While I wait to see if anyone has a question, I wanted to remind you that there is a drawing today for 2 of Tim's co-authored books, and the drawing was done during the presentation. So Ann Mead and Leah Coyle will receive copies of Tim's books. You'll receive an email from the Global Rural Nurse Exchange Network from Stacy to get your address so that those can be mailed to you.
Enjoy the books. And if you have trouble sleeping, keep it by your bedside because it's a total snoozer. I'm just kidding. I hope it's not a snoozer. I hope you enjoy
It's
it.
not. I actually have one here. I do see a note that says, I'm trying to capture some of the books you've mentioned to share with our group. Do you by chance have those you can send us?
Yes,
So,
maybe if it's okay, I'll just send an email. Is that
Sure.
what you, okay, and then you
That'd
can
be great.
Can do. I'll write a note.
So I want to take a moment and to thank each and every one of you for being present today, for taking ownership of your time to spend some time with us today. I'll be happy to hear in the future what everyone's done in relation to this post-traumatic growth as we're all continuing to live. The coronavirus pandemic had a significant impact on everyone. And I'm happy to see and hear things that we can all put our work behind to help improve. So, Tim, thank you. Thank you for your presence, for sharing you, for being a shining light, and to your organization that you work for. You have the coolest job title. So I think that's great.
Much.
I'm seeing just a few other notes in the chat box. Again, giving thanks to Tim. I'll let him read those. And if there's no other questions, we're going to let you get on to your morning or your evening, depending upon where you are at this time. And we just thank you. You can check out the GRNEN webpage. It's grnen.org to see other opportunities to interact with us, to participate in our future webinars, and to reach out. So thank you.
Bye-bye. Thank you.